Daniel Hale Williams was born in Pennsylvania in 1856, and 12 years later, when his father died, he was taken to Baltimore, where he was apprenticed to a shoemaker. His father had been a barber and passed on his skill to Daniel, who at the age of 18 moved to Wisconsin, where he supported himself barbering while attending high school. After graduation, he continued to study as an apprentice to one of the most highly accomplished surgeons in the area. Working side by side, he learned his medical lessons as well. Recommended by the doctor he worked for, he was accepted by the Chicago Medical College and received his degree in 1883. At that time, because black doctors couldn't work in Chicago hospitals, he set up his own practice. Dr. Dan, as he was affectionately called by the black and poor white patients he treated, was painfully aware that discrimination still barred blacks from treatment in Chicago hospitals. In 1891, he took action. Dr. Williams opened Providence Hospital and Training School for Nurses, the first non-segregated hospital in the nation to welcome and care for patients regardless of race. In July 1893, a man with a stab wound in his heart was rushed to Providence Hospital. Heart surgery had never been done before, but a man's life depended on his skill. Deftly and swiftly, Dr. Dan opened the chest and saw that the wall of the heart had been pierced. He sutured the damaged organ to save his patient and make medical history. His reputation earned him the post of Surgeon-in-Chief of Freedmen's Hospital in Washington, D.C., where his innovations led to a major decline in their mortality rate. When Dr. Dan returned to Providence, he helped the hospital grow from 12 to 65 beds. He lectured nationwide, encouraging black doctors to start hospitals so black patients would never receive second-class care. His dedication earned him the respect of all. He was the first black physician named as a fellow in the American College of Surgeons, and he became the first vice president of the National Medical Association. Today's heart, lung machines, plastic heart valves, and heart transplants represent milestones on a long journey, and Dr. Dan took the first step. He died in 1930.